Women's shocking reports of subpar treatment at the hands of a plastic surgeon previously jailed. Bangkok and Thailand have become a world headquarters for economically priced cosmetic surgery as part of a broader medical tourism boom, which has been tainted in the last decade by disturbing reports of patient deaths at clinics offering substandard and sometimes unregulated care. A campaigning Thai lawyer, on Tuesday, shone a light on the dark recesses of cheap and dangerous plastic surgery in Bangkok, known to be a world-beating center for cosmetic procedures at low prices, but which, in the last decade, has faced disturbing questions about the regulation of smaller clinics where several fatal cases have been reported in respect of relatively minor procedures. The case in question is one of a doctor previously jailed for the death of a patient who has reopened up and is the subject of harrowing and substantiated claims from two Thai women who brought their story before reporters on Tuesday. On Tuesday, activist lawyer Mr. Ranarong Kawet, Inset Left, introduced two women, 37-year-old Ms. Nam, left, and 25-year-old Ms. Tao, right, who detailed their nightmare treatments at the hands of a Hoi Quang-based plastic surgeon who was previously jailed for the death of a patient at his clinic in a liposuction procedure. Well-known Thai lawyer Ranarong Kawet, an activist against injustice and wrongdoing in the kingdom, held a press conference on Tuesday and presented two victims of a plastic surgeon operating in the Hoi Quang area of Bangkok who was previously the subject of a police investigation after a death occurred at his surgery of a patient admitted for a liposuction procedure. The doctor was subsequently jailed for the incident in 2021, served his time, and was then released but appears to have been able to resume his practice. Victims shed light on the danger of opting for cheap, low-cost clinics run by plastic surgery practitioners without proper training or regulation. The latest two victims are from his renewed practice, which opened again in the Hoi Quang district. They are the latest cautionary tale in an industry which has been under suspicion for the last decade due to several high-profile cases, including deaths. Plastic surgery has become a massive business in Thailand over the last 2 decades, with many Thai hospitals and clinics receiving high awards and meeting international standards. Many of the larger Thai hospitals, including Bumrungrad Hospital, Yunhee Hospital, Samadich Hospital, Bangkok Hospital and Lorlak Hospital, have installed advanced plastic surgery equipment and treatment centers meeting the highest standards, with Bangkok becoming a world center of the business with competitive rates varying from as little as $24, 850 Thailand bahts, to $10,000, 370,000 Thailand bahts, offered by private clinics and large medical institutions in a busy marketplace. Plastic surgery acknowledged by the government as part of Thailand's medical tourism push, with 9.6% of tourists in 2013 coming to receive treatment. In 2013, the Thai government acknowledged plastic surgery as a critical part of its efforts to promote medical tourism to Thailand, with the country earning $4.31 billion alone from medical procedures. It is estimated that 9.6% of all travelers to Thailand came for this purpose and benefit. Afterwards, this was overtaken by rival medical tourism centers, notably in India and Turkey, but Thailand remains a leading center in the worldwide industry, especially linked with plastic surgery. However, several fly-by-night operators, particularly in Bangkok, have given the trade a bad name, leading to negative international press coverage, such as that concerning the SP Clinic, which was at the center of a controversy in October 2014 when police arrested Dr. Sompop Sansiri after the death of a 24-year-old British woman, Joy Williams, who had been a patient at his clinic and died subsequently under anesthetic. Channel 4 documentary in the United Kingdom in 2015 has since been widely circulated and raised serious questions about regulation of the industry. Her relatively straightforward plastic surgery went awry. A police investigation subsequently revealed that the clinic was not appropriately licensed by Thai authorities to carry out such surgery. The case raised disturbing questions about Thailand's ability to regulate and control the fast-growing industry. Thailand, where plastic surgery tourism can be fatal. Channel 4 News. The case was the subject of widespread coverage in the United Kingdom, including a groundbreaking TV exposé produced by Channel 4 in February 2015 highlighting the fatal consequences for some patients who visited Bangkok for plastic surgery procedures, in which the Thai capital was described as world headquarters for cosmetic surgery. Two Thai women, the latest victims of an apparent fly-by-night operator already held responsible for one patient in 2021, presented to a press conference. On Tuesday, lawyer Ranarong Kawet presented two of the latest victims of another well-known plastic surgeon. This fly-by-night operator fell foul of the law and served time in prison. Mr. Ranarong identified them as 37-year-old Ms. Nam and 25-year-old Ms. Tao. Ms. Nam attended the clinic in Hoi Quang for surgery on January 7, 2022. The nose procedure was carried out at a price of 25,000 Thailand bahts. Later, on Tuesday, the woman told the press that 7 days after this procedure, she took the cast off and discovered that her nose was anything but beautiful, so she contacted the doctor at the recently reopened clinic. He suggested that she return to him so that the matter could be put right and that 3 different procedures were carried out in 1 week, but to no avail. She told reporters that over 1 year, she had had 16 revisions on her nose performed by the clinic's owner. Woman's nose became repeatedly infected in the course of 16 revisions over a 7-month period, leading her eventually to lose her job and confidence. During that time, her nose had become infected, and the doctor had advised her to purchase painkillers and certain medicines, including 7 bottles of disinfectant, to clean her nose internally. She told reporters that she used 1 bottle daily, but the nose infection became a recurring one. At length, she was told by the doctor that it was not possible to make her nose beautiful as it was intrinsically not so. She would have to get better on her own, he said, because her case was a difficult one to solve because her nose was fundamentally not beautiful. And, of course, she explained at today's press conference, after 8 months of toing and froing with the doctor, she finally lost her patience and her confidence in his ability to correct the situation. 37-year-old filed a complaint after she completely lost faith in the doctor's ability to correct the mistakes and address the botched job on her nose. Then I went to have my nose fixed with the doctor for the last time. This was last August, and it didn't get any better. So I decided to tell the doctor I wanted to terminate the treatment because after doing it repeatedly, it was not getting better and appeared to be getting worse. Also, I was losing money on travel expenses, and my nose was continuously sore, she explained. In addition to this, I had been fired from work because of numerous periods of extended leave, which had a very negative impact on my life. Nowadays, I don't care to meet people face to face anymore. I must wear a mask all the time. I went from being a normal-looking person to someone who has to wear a mask for the rest of my life, the 37-year-old said. She explained to the press conference that the doctor subsequently denied responsibility for her situation. He pointed out that he had provided the nose corrections free of charge and at considerable cost to his clinic. Because of this, she said she had filed a complaint against him and sought compensation for damages incurred from the subpar treatment she thought she had received. She found out about the death at his clinic previously but opted to stay with him as he kept promising to rectify her condition, but eventually, he gave up. She told reporters that around the 5th or 6th time she had returned to correct her nose, she became aware of the doctor's unfortunate history. At any rate, she learned he had been held legally responsible for the death of a patient in his care. Nevertheless, she continued to place herself in his hands because she thought that her nose would get better. She was impressed by the fact that the doctor continued treating her. The second patient introduced by the activist lawyer was 25-year-old Ms. Tao. She attended the Hoi Quang clinic for double eyelid surgery and facial contouring. This involved initially altering her cheekbone with grinding and delicate hairline surgery, which involved the doctor cutting her scalp. 25-year-old woman had a bone and structural procedure to her face in May 2023, followed by eyelid surgery in October this year, which went very wrong. The second procedure involved moving her scalp down and also making alterations around her mouth under anesthetic. She said she was not sure if the doctor used the proper anesthetic. The first facial contouring surgery was performed by the plastic surgeon in May this year. She said that after the operation, she felt her cheekbones were bulging and not as expected. She returned to have double eyelid surgery conducted on October 25, 2023. But here also, there appears to have been some mistake. The result of the plastic surgery was that her face was not more beautiful, indeed, it was visibly scarred. Furthermore, her eyes appeared to be misshaped. She informed the doctor at the center of these allegations, and he told her to return and carried out a second surgery on October 27, 2023. This caused even more complications and involved many mistakes. At that point, she asked the doctor to take responsibility for his actions and said that she had lost confidence in his ability to carry out the surgery successfully. Following this, he insisted that in 1 to 2 days, he could correct the situation and that she would look beautiful. Paid 124,000 Thailand bahts but was left scarred both externally and internally for life, as well as restricted movement in her eyes, mouth and arms after flawed surgery. She told reporters that she had paid 103,000 Thailand bahts for the facial contouring operation and 21,000 Thailand bahts for the eyelid surgery. The result of the overall surgery was that she was left with severe scars and a damaged face, with the scars visible on the outside. Subsequently, a CT scan conducted by other medical advisors showed that her face was damaged internally. She told reporters that her face was whole, and the scan showed her eyes were not as expected. The victim, before the press, described her situation as being scarred for life. At the same time, Ms. Tao claimed she could not open her mouth properly, and neither could she close her eyes completely. By the same token, she told reporters that tears flowed all the time from her eyes without any ability to control them and that she dared not expose herself to the wind. In addition, she explained that she could not lift her arms at a height because the surgeon had taken fat from her armpits when conducting the eye surgery, causing further medical complications in this area of her body. The situation had led her to question whether the doctor at the plastic surgery clinic was properly qualified or even a medically accredited professional. Latest victim took to TikTok, where she claims many other victims contacted her online, sympathizing with her plight at the hands of the plastic surgeon. She told the press conference that she was now pursuing legal and other actions against the plastic surgeon to remedy the damage done to me by his clinic. I don't want to see this happen to anyone else, and want to find out why this doctor continues to be able to practice. He has been to prison before. She went on to explain to reporters that this is why she had made a TikTok video exposing her own story and revealed that she was contacted by many other people on the social network claiming to be victims of the same surgery and doctor. The activist lawyer, Mr. Ranarong, said that he was having detailed physical examinations carried out on both of his clients and would be making a full report to the Crime Suppression Division of the Royal Thai Police. Additionally, he would be filing a report with all civil authorities, including the Provincial Administration Organization and the Office of Basic Education Commission, to find out if the surgery in Hoi Quang was approved under current regulations and medical guidelines. Lawyer Ranarong bringing now documented cases to the Crime Suppression Division, CSD, of the Royal Thai Police and civil authorities demanding action. He would also be in contact with the Medical Council of Thailand to see if this doctor's license has been revoked or whether it has been suspended. He explained that if it turns out that the doctor is medically accredited as a professional, then the charges against him would be ones of negligence while causing severe harm to others, while if it is discovered that he is not an accredited doctor, he would be facing criminal charges of assault, causing severe bodily harm. The media at the press conference on Tuesday also heard from Ms. Sarantip Wainwright, the coordinator of a beauty group that helps victims in situations relating to plastic surgery clinics. She revealed that the two cases had been sent to professionals and approved doctors for evaluation. Victims Coordinator dealing with plastic surgery abuses in Thailand has brought in experts to assess both women's conditions. The story is disturbing. About Ms. Tao, who had eyelid surgery and facial contouring, her information was that Ms. Tao's eyelids had contracted because of the surgery. The condition was causing problems with her ability to close her eyes and weakening the muscles in the appropriate area. She revealed that this would require specialist treatment from a qualified doctor. This was being arranged, and the first correction would take place this week, but it will take 6 months before the situation for the patient can be improved. It should also be noted that she has been told that Ms. Tao will never recover 100% to the way she was before following the plastic surgery clinic's mistakes. Both women require years of surgery costing well over 2 million Thailand bahts each, and at least one will never fully recover from the damage inflicted on her in 2023. Ms. Sarantip then addressed the surgery on Ms. Tao's forehead and eyebrows. She explained that the doctor appeared to have carried out the wrong surgery and made unnecessary wounds, including alterations to the victim's facial bone structure. She said further x-rays were required, but it appeared that the victim's facial structure had been altered. In conclusion, to remedy this problem would take over a year at a cost of 2 million Thailand bahts, with the surgery carried out by accredited professionals. Dealing with Ms. Nam's nose job, she said this had also been sent to doctors for evaluation, and they were still waiting on a more detailed report. However, a culture from Ms. Nam's nose has been examined, and it appears she suffers from a chronic infection. The victim's group coordinator suggested that this may have been caused by the use of artificial tissue that is often used in corrective surgery. In any case, to remedy this situation would also require professional intervention at a cost of more than 2 million Thailand bahts. In addition, this surgery would take 1 to 2 years to complete.